When we perform orthodontic tooth movement, we basically have different types, and the center rotation of the tooth will be different depending on the type of movement we want to express. The only problem that is not well studied is the bone response to this type of movement. So let's start now with uncontrolled tipping, where the center of rotation is slightly apical of the center of resistance, but is not at the apex. What happens is we have a rotation of the tooth, as you can see, and after about 10 degrees, the apex starts to go right through the cortical plate if there is no remodeling, and the pressure on the lingual dentoalveolar process at the crest is significant. So that's for uncontrolled tipping. If now we go for pure torque, where now the center rotation is coincident with the center resistance, we immediately see that the root is, the apex is going through the cortical plate fairly quickly, and there is also some pressure on the lingual cortical plate. So that's the movement. The question we have is, what kind of remodeling are we going to get? Is the tooth going to be better supported, or is some bone will form around the apex and reshape the lingual plate? Now if we go for pure translation, there is a different amount of resorption. You can see that the buccal plate is not touched, and it's a tension, there is some tension there. The lingual aspect of the dental process needs to be remodeled in a considerable manner. Now let's go for torquing, and if we are able with a mechanical system of forces and force couples to move the center rotation of the tooth at the incisal aspect of the tooth, this is the type of movement we can expect and what kind of reaction we can get from. So immediately you can see that there is a lot of remodeling that needs to be done on the buccal aspect of the cortical plate. The tooth is now rotating. You can see the center rotation should be moving with the tooth, so your mechanical system, but you can see immediately that there is a significant amount of remodeling that needs to happen on the buccal cortical plate, and the lingual is actually untouched. So all these movements, and in the last one we can look at is controlled tipping, which is very useful for bimaxillary protrusion. So let's see on this tooth what kind of movement you're going to get. And again, you can see exactly the reverse from the torque, that the buccal plate is not touched, the root stays in bone, but there is significant remodeling that needs to happen on the lingual of the plate, because there is immediately a lot of stress placed on the lingual cortical plate. So all these movements that we do in orthodontics have the potential to require significant remodeling of different aspects of the dental-alveolar processes, and the force system must be consistent and in tune with the amount of bone remodeling that can occur. Thank you.